Yes? And what about anything else before we leave this topic, inside, outside the hospital, to combat resistance, other than what we've been discussing?
The best way to prevent resistance is to prevent an infection that needs an antibiotic, period. And so although
vaccines,
the Ds that have been described deal with the antibiotic piece, the whole prevention piece, whether it's vaccines, but more importantly, the simple things that we do in the ICU every day, head of the bed elevation, using OG tubes versus NG tubes, decreased sedation and the bundle leading to earlier liberation from the ventilator.
Wash your hands.
You can't have that.
Oh wait, she just said it. Wash your hands.
If hospitals, if patients actually saw what true hand hygiene compliance rates were in the hospital, they would be appalled. And we all know it's an issue. Yes.
I don't want to leave this, and because the appall factor just rose up to nauseate me. Why is it so darn hard to get healthcare professionals to wash their hands? What's going on here? Anybody have an answer? Please. Nothing.
So again, one of the best interventions that's been affected to actually change prescribing or hand hygiene practices was the secret shopper approach. And I don't mean the secret shopper where Nurse X is auditing her colleagues in the ICU about how they do it, or even it's hidden camera.
Yep.
And there's some data from North Shore, or whatever they call themselves this month, North Health or whatever, but they have some nice data with you don't know if the camera's on or not, so you don't know if you're being watched or not, and they actually tracked hand hygiene compliance and it went up really substantially. So it's like preventing shoplifting.
I mean, I just don't get it. If only for your own protection and for your family's protection, you're going to bring these things home.
Right. I mean, our problem now is we've got the dispensers outside of every room, and we just can't get environmental services to refill them dispensers. Because we actually use them. Right, we use them and then they're empty, and then people are like, well, why am I going back to try to use it? It's empty. And so it creates another negative reinforcement in the loop.
Except that they don't work for C. diff.
Right, of
So
course.
good luck on that one, too.
Soap and water's still good.
I'm just, we could go on for the next year because this is one of these things that just appalls me. Me, personally. Wash your hands. Cut it out. Wash it off. Those days are gone. I mean, Lister did prove this, right? you can sanitize the human skin better than what we're doing. All right, enough, because then I just get angry and pound the table, and I don't want to do that because we've had a great discussion, and now it's time for us to go around the table once and to leave our viewers with at least one point, one takeaway point that each of you thinks is important. So why don't we start with Dr. Estrada?
Sure, so I think it's an exciting time to be doing infectious diseases and antimicrobial stewardship, and the key point that I have seen so far is collaboration. So if you look at everything we've talked about today, really just working together, educating each other, and understanding how the role that we play can make a difference for patient care will lead us to the next steps in the future of decreasing antimicrobial resistance.
Dr. Goff?
Well, I think the responsible use of antibiotics is really a shared role between healthcare providers, patients, and consumers. And we have to continue to educate all three groups in order to win this battle against antibiotic resistance.
Dr. Pogue?
Yeah, I mean, obviously I just want to echo what you guys said, but in addition, I think that a key component of stewardship, as you've heard, is getting patients on the right antibiotic. And that involves taking patient-specific information, local epidemiology information, and where it's appropriate, newer antimicrobials fit into that story as well. And so really think what's best for your patient as well as the hospital and get your patient on the best therapy.
Dr. Shorr?
Well, I think to build on this theme of team sport and collaboration, we need to bring in people outside the institutions besides patients and patient advocates, and we really need to be appealing to our policymakers and our legislators to really realign incentives so that quality payments actually reflect quality behavior as opposed to just punishments for the hospital, so that pharmaceutical developers actually have legitimate incentives to risk the capital to go in and develop antibiotics which don't pay the way chronic cancer therapies do. And all of these things need to change at a national level if we're going to actually have the tools we need and a shift in mentality where we realize that antibiotics are a public resource and therefore require public stewardship.
Well, I want to thank all of you. If I have one message for you before we go, it's please, wash your hands. Just do this. This is simple stuff. And with that, I want to thank all of you for being here. I want to thank all of you for watching as well. It's been a great discussion. I think I speak for everybody here to say thanks for watching. Thanks for joining us. I'm Dr. Peter Salgo, and I'll see you next time.